I'm delighted to introduce Alberto Palma. He's also an extraordinary doctor. I was doing the numbers, and he has been at the center already for 7 years. He's our own homegrown scientist. Of course, he was a great scientist before he came, but he was a fellow at the center for 2 years, clinical and research fellow, and then he was an instructor, an associate professor, an assistant professor, and now he's an associate professor. Alberto is an outstanding doctor. Not only he has an MD, he also has a PhD in sleep, which, needless to say, became handy and very useful for his work in FD. He has done incredibly interesting work, particularly on the abnormalities in sleep. Many of those have been published, and he will be telling us briefly today a number of interesting things about the use of non-assisted ventilation. Alberto, thank you so much, and take it away.
Thank you very much, Horacio, for that kind introduction. Good morning, everybody. So today I'll be summarizing some of the problems that patients with FD have in terms of sleep and respiration, and we'll also let you know about some of our recent research on this regard. But my goals are, you'll see, there are very succinct and very specific take-home messages so that you don't miss anyone, right? So when we breathe, we all take that for granted, right? And that's taking air in, taking air out is automatic, right? But it's not really that easy. It's so complex, There are thousands of nerves involved, thousands of areas, of hundreds of areas in the brain involved, and most people do it with no problem. But unfortunately, in FD, this is not working properly, right? And that's what is causing these sleep problems during sleep, right? And how frequent this is? Well, it's surprisingly frequent, In patients, in adult patients, 8 out of 10, meaning 80%, have some degree of sleep disorder, breathing at night. And this is even more frequent in pediatric patients. In pediatric patients, it's 9 out of 10, right? So, and I can remember in my mind exactly those patients with FD who do not have respiratory problems at night on the sleep study, right? Because they are so infrequent that it's surprising. Most of them do have some problems, right? And what is the specific nature of the problem? Well, one of it is sleep apnea, as you know, right? So what happens with the apnea is the following, right? So with the normal breathing, the air comes in and out with no obstruction through the nose and through the mouth, right? When we are sleeping or even when we are awake. But in sleep apnea, there is some degree of obstruction. Sometimes is the tongue falls back, and there is and that blocks the airway. But some of the times is not at the level of the tongue. It's maybe lower. Sometimes it's the tonsils. But nevertheless, what this causes is not enough air coming into the lungs, and this results in problems with blood gases, right? So this is the first take-home message, right? So respiratory problems during sleep are virtually universal. I mean, there is a minority of patients who do not have any problems, but most of them do. Now, what are the consequences of respiratory during sleep? Well, as I mentioned before, right? So it's related to blood gases. There is the oxygen, which is the one our body uses to get energy, and broadly speaking, we need our blood levels of oxygen to be pretty high. And there is the CO2, which is the other gas that our body wants to eliminate, right? And so our CO2 levels in blood should be low, right? So this is the usual ratio, or the normal ratio that we should have. But when we don't breathe properly, either during wakefulness or most intensely during sleep, this is what happens. This ratio reverses, right? So the oxygen levels go down and the CO2 levels go up. And this is bad for a number of reasons, right? So people when this happens, you can get you feel drowsy in the mornings, your cognition doesn't work properly, you feel brain fog, you are not as sharp, but most importantly, it has effects on the heart. And these type of gas ratios, low CO2, low oxygen and high CO2 levels in patients with FD can cause problems with the heart rhythm. It usually lowers it, and these can be further causing arrhythmias, which of course, some of which can be lethal. So it's a serious problem, right? And this was published last year. Just let me give you a summary. This is how we determine that sleep disorder breathing and not using CPAP or BiPAP had serious consequences in patients with FD, right? So we did a case control study in a nutshell, right? We compared patients with FD who had a fatal outcome during sleep and compare them with patients who were still surviving. And basically, we found 32 patients who had the event and had a sleep study, and compared them to 31 patients who also had a sleep study but didn't have any problems. And the first group is referred to as cases and the second group is referred to as controls. And this is a summary of the results, right? So as you can see, those patients with cases, meaning those who had the accident or the event, had significantly higher number of apneas, meaning stops, pauses during sleep, compared to those with controls, right? So patients who had the event had 20 episodes of stopping their breathing per hour compared to just 8, right? So this is a significant difference. And as expected, the oxygen levels of those who had an event were significantly lower compared to those who didn't have any problems, right? And again, this is very obvious. So this is my second take-home message. Untreated respiratory problems during sleep are associated with bad outcomes, right? And using CPAP or BiPAP can prevent these problems. This is the most recent piece of research we just published a few months ago, and it's interesting. Let me go over with you. So we measured blood gases in patients with FD during the day while they were in the office, right? So they were not using CPAP or BiPAP at that time. And we measure them before they started CPAP or BiPAP at night, and then after they started CPAP or BiPAP at night. But again, we are measuring the blood gases during the day, okay? So, and what we found is interesting. The CO2 during the day, even when the patients were not wearing the BiPAP, was significantly lower after using the CPAP or BiPAP at night, meaning the CPAP or BiPAP, it's still working to lower your CO2 levels even when you are not wearing it, right? So this is pretty good, and it's another reason to encourage everybody that needs it to use CPAP or BiPAP, right? So CPAP or BiPAP works even when you're not using them. Well, of course, I know what you're thinking. You're thinking, Dr. Palma, what you're telling me is great, but have you ever used a CPAP or a BiPAP? It's the most uncomfortable thing ever. And you know, we hear you, and we are so proud of all of you who are using the CPAP or BiPAP and who are compliant with it, and we are aware of the limitations. So my next part of the presentation is just to go over with you a few strategies that are available to improve the possibilities of you using CPAP or BiPAP, and even in those who are already using it, maybe these improves things, right? So again, I'm fully aware of these, right? Most of you tell me when we talk in the lab, you know, the mask is uncomfortable, I can't tolerate the forced air, I have difficulties falling asleep. What can I do? Well, there are many things you can do. There are many things we can do. I'm going to just talk about 3, but there are many other strategies, and we can talk later if you want more information, right? So the first thing that we have to ensure is that we find the proper mask for you, right? There are now many different types of masks, right? You have nasal only ones, you have the whole traditional mask, different type of straps, and For some people, the nasal one is better. For other people, the larger one is better. We just have to find the right one for you. And the sleep center you work with can help you. We can help you. So this is something that we definitely need to work on, right? Some people take a step further and they want more special masks, right? So you have the alien face hugger mask, the Bale from Batman mask, or the Star Wars Darth Vader masks. These are real masks I found on the internet, right? So you just have to find the right mask, right? That's the first strategy, finding the right mask. The second strategy is something called desensitization. It's a fancy medical word just to tell you to take baby steps, right? And what is this? This is, well, for instance, when you start using the BiPAP, I mean, it's something very uncomfortable, right? So what we tell patients is, okay, so just the very first night, you're gonna use it 15 minutes, right? And that's it, right? Then the next night, you can use it 20 or 30 minutes, okay? And that's it, and so on. And the time will arrive when you're using it for 6, 7, 8 hours, right? It may take time, it's fine, but that's definitely better than nothing. And this is a pretty good strategy. It helps people get less anxious about using the CPAP. Another possibility is some people use it while they are awake, right? Just to get used to the mask, to get used to the flow, to get used to the pressure, and this also helps. Now, the third option I'm going to talk about here is to try the ramp feature of the machine, right? What is this ramp thing? Well, some machines, particularly the most recent ones, have these self-regulating feature where the machine can detect how much flow you need, right? And the thing is that they usually start very slow and very mild and very soft, right? And when the machine sort of assumes that you have fallen asleep, the pressure goes up, right? So it's something like this. It's a CPAP model that can adjust itself, right? I mean, you take the joke, right? And this is my fourth take-home message and my last take-home message, right? So getting used to CPAP, BiPAP, I know it's a pain, I know it's challenging, I know some of you don't want to talk about it, but it's possible, right? Kudos to all of you who are using it. We know who you are, congrats. And I encourage you who are not using it, we know who you are, to talk to me after that, right? And we have many strategies to help you achieve this, right? And we can do it together. And this is my last CPAP, right? My last slide. The CPAP or BiPAP is the sleep apnea theory, right? There is no magic thing. I mean, it's just we have to try and use it. And trust me, the benefits of using it outweigh by far its inconveniences, right? So I'll be happy. I'm going to be here all day, so I'll be happy to talk to you about these a little bit more if you have questions. Okay. Thank you very much.